Hey guys, myself Manisha and I'm here to discuss about hemophilia. It is a royal disease. If we see the objectives, introduction, definition, classification, etiology, pathophysiology, clinical manifestations, diagnosis, treatment, and complications. Introduction. Hemophilia is an inherited bleeding disorder due to deficiency of plasma coagulation factors. People with hemophilia have low levels of either factor 8 or factor 9. It is primarily found in males but transmitted by female carriers. Hereditary hemophilia account about 80% of cases as sex-linked chromosomes. About 20% of cases may account as acquired hemophilia due to autoimmune disorder or spontaneous mutation. Hemophilia has been called royal disease. This is because the hemophilia gene was passed from Queen Victoria, who became Queen of England in the year 1837, to the ruling families of Russia, Spain, and Germany. Queen Victoria's gene for hemophilia was caused by spontaneous mutation. If we see the definition of hemophilia, it is a congenital bleeding disorder caused by lack of at least any one coagulation factor. Types of hemophilia. The following two are the common: hemophilia A, hemophilia B. If we see hemophilia A, it is also called as a classic hemophilia. This type is caused by a lack or decrease of clotting factor 8, the anti-hemophilic factor. It accounts for 80 to 85% of all cases, 1 in 5,000 to 10,000 male births. Hemophilia B. It is also called as Christmas disease. This type is caused by a lack of decrease of clotting factor 9, the plasma thromboplastin component, 15 to 20% cases, 1 in 20,000 to 34,000 male births. Less commonly, we see hemophilia C. This type is caused by a lack or decrease of factor level, plasma thromboplastin antecedent, Hedgeman's disease, deficiency of factor 12, von Willebrand's disease, reduced level of von Willebrand's factor, a protein that binds with factor 8 and protects it from rapid breakdown within blood. Etiology. Hemophilia is a genetic disorder. It happens when there's a gene change, which usually is inherited, means it passed from parents to child. Clotting factors control bleeding by helping the body from a clot. Our bodies have 13 clotting factors that work together to clot blood. Having too little of factor 8 or 9 is what causes the hemophilia. Hemophilia mostly affects boys. Pathophysiology. When injury occurs at the damaged area, injury to the blood vessels results in bleeding, and at the natural clotting factor, vessels constrict and clotting factors are activated. And they again have a normal hemophilia and a hemophilia. If we see the normal hemophilia, natural clotting factors helps from a strong platelet plug, and a stable fibrin mesh forms a sealed clot over the platelet plug to stop the bleeding. If we see the hemophilia, lack of natural clotting factors means only a weak platelets plug can form. Incomplete fibrin mesh allows the bleeding to continue. Clinical manifestations: prolonged bleeding anywhere from or in the body, hemorrhage from any trauma, loss of deciduous teeth, circumcision, cuts, epistaxis, injections, excessive bruising, even from slight injuries such as fall, subcutaneous and intramuscular hemorrhage, hematorosis, bleeding into the joint cavities, especially the knees, ankles, and elbows. Hematomas means the pain, swelling, and limited motion. Spontaneous hematuria, GIT, bleeding, intracranial hemorrhage. If we see the diagnosis, we can diagnose hemophilia by family history, the symptoms, laboratory tests like coagulation studies, activated partial thromboplastin time, and specific factors, genetic testing, DNA analysis, other tests like bleeding time and genetic analysis. If we see the treatment, Replacement of missing coagulation factors. Factor 8 made from chiroprecipitate hemophilia A. Factor 9 and level made from fresh frozen plasma. Fresh whole blood transfusion can be given if the commercially prepared factors are not available. Mild to moderate hemophilia. Desmopressin release of factor 8 from the endothelial stores. Antifibrinolytics, aminocaproic acid and tranexamic acid are given for the mucosal bleeding. Supportive management for amatrosis, pain, analgesic like paracetamol or NSAIDs. Avoid aspirin, indomethacin, and beta-zolidone as they inhibit platelets function. Synovectomy can be recommended to remove damaged synovium. Orthotics can be used to prevent injury. Gene therapy is now under research. Genetic counseling and antenatal diagnosis should be arranged. Latest hemophilia treatment, emicizumab. This is a newer drug that does not include clotting factors. This drug can help prevent bleeding episodes in people with hemophilia A. Fitusiran. It is the first drug for hemophilia which is effective in both factor 8 and factor 9 deficiency even with inhibitors. Concizumab. It is a novel subcutaneous prophylactic therapy for hemophilia B. It is indicated for treatment of people with hemophilia B who have factor 9 inhibitors and require routine prophylaxis to prevent or reduce the frequency of bleeding episodes. If we see the complications, airway obstruction due to bleeding into the neck and pharynx, intracranial bleeding, intestinal obstruction, compartment syndrome, degenerative joint disease, chronic hepatitis, risk of HIV and AIDS. Summary. Hemophilia is a inherited bleeding disorder due to deficiency of plasma coagulation factors. Affected children may bleed easily. Parents must be taught about careful handling of children and prevention of injuries. For more information, you can refer National Institute of Health, Medline Plus, Mayo Clinic. Thank you.